Good evening. Today I will be telling about typical rib of the right side. First, I'll be telling about side determination and anatomical position. The side of the rib can be determined by holding it in such a way that its posterior end, having head, neck, and the tubercle, is directed posteriorly. Its convexity faces medially, and the sharp border is directed inferior. Typical ribar. It is curved throughout. It is angulated. That is, it presents two bends. One 5 centimeter in front of the tubercle, and other is 2 centimeter behind the anterior end. It is twisted along the axis. Now about its features and attachment. The anterior costal end bears a small cup-shaped depression that joins the corresponding costal cartilage that forms the primary cartilaginous joint. The posterior end has head, neck, and tubercle. The head has two articulating facets, the lower and the upper. The lower larger facet articulates with the body of numerically corresponding vertebra, and the upper smaller facet articulates with the next higher vertebra. The crest separating the two articulating facets lies opposite to the intervertebral disc. The neck lies in front of the transverse process of the corresponding vertebra. It has two borders, superior, inferior, and two surfaces, anterior and posterior. The upper border is sharp and crest-like, whereas lower border is rounded. Tubercle. It is situated on outer surface of the rib at the junction of neck and the shaft. It is divided into two parts, the medial articulating part and the lateral non-articulating part. The articular part bears a small oval facet that articulates with the transverse process of the corresponding vertebra. The non-articular part is rough and provides attachment to ligaments. Shaft is thin and flattened. It presents two surfaces, the outer and the inner, two borders, upper and lower, and two angles, posterior and anterior. The posterior angle is known as angle of rim. Now I will be talking about borders. The superior border. The superior border is thick and rounded and presents outer and inner lip. The outer lip gives attachment to external intercostal muscle, and inner lip gives attachment to internal intercostal muscles and intercostalis intimus muscle. The lower border is sharp and forms costal groove that gives origin to external intercostal muscles. Now surfaces. Outer surface. It is smooth and convex and presents two angles, the posterior angle and anterior angle. The posterior angle is marked by oblique ridge and anterior angle is marked by indistinct oblique line. The costal groove lodges intercostal nerves and vessels from about and onward as follows: the intercostal vein, intercostal artery, and intercostal nerve. The internal intercostal muscle is attached to the floor of the groove, and intercostalis intimus is attached to the upper border of the costal groove.